Thank you all so much for joining us for day 2 of our Migration is Beautiful campaign. We're really excited to have you here and also to have some amazing speakers today. I'm Fiona Danaher. I'm a pediatrician at MGH Chelsea, where I'm calling in from right now, and also the director of the new MGH Center for Immigrant Health. And we are thrilled today to have representatives from the Massachusetts Immigrant and Refugee Advocacy Coalition, Healthcare for All, and the Service Employees International Union to talk to us about some important bills pending before the Massachusetts State House that will really make a difference for our immigrant patients, family members, and colleagues. So with that, I will hand it over. And looking forward to learning how we can advocate.
Well, here we are. I guess I'll start. My name is Amy Grunder. If you actually flip to the next slide, you'll see all three of us. Here we are. So I guess I'll start. So I'm Amy Grunder. Some of you know me. I work with the Massachusetts Immigrant and Refugee Advocacy Coalition, where I direct our state legislation and policy. And I also, not only our legislative campaigns, but also campaigns in the state budget to ensure adequate resources for programs that support immigrants and refugees across the state. But as in that role, I also serve as the representative for MIRA at the Safe Communities Coalition, which is a coalition of about, I would say about 100 groups with varying levels of participation that are supporting the Safe Communities Act that's pending before the state legislature this session. I'll hand it over to Dalida Hosha. Take it away.
Thanks, Amy. Hi, everyone. My name is Dalida Hosha. I am the political director for SEIU, which stands for Service Employment International Union. And it represents janitor, security officers, and maintenance workers here in Massachusetts as well as Rhode Island, but also across up and down the East Coast. And I also serve as the co-chair for the Driving Families Forward campaign, along with my other co-chair, Dr. Natalicia Tracy. And Driving Families Forward is the coalition that brought the driver's license legislation that is still pending in the legislature for this session. Thank you.
My name is Maria Gonzalez Albuquerque. I am the Director of Communications and Immigrant Health at Healthcare for All. At Healthcare for All, we do many things, and one of them obviously is advocating for better policies that improve access to healthcare in Massachusetts. And today we're going to be talking about one bill that is supported by a couple of our coalitions. One is the Children Health Access Coalition, and the other one is the Immigrant Healthcare Access Coalition. And I'm not going to give you what it is because I want to tell you later. Oh, yeah. Unveiled.
This is the fun part. So we sort of envisioned this as we don't want to do, actually, if you just flip back up to the former one again. Yeah, so we wanted to give you a little bit of background as opposed to sort of like having three talking heads here. We hope to, sort of, I'm inviting my colleagues to jump in and sort of do this together. I think it'll be more fun that way for everyone as well. But a little bit of background, maybe we should start with the Work and Family Mobility Act, the driver's license legislation, Dalida, since it has the longest history of the three bills that we're discussing today. You want to say something about where it comes from and where we are?
Sure. So the Work and Family Mobility Act, also known as driver's license, and it's a legislation that has been filed for, as far as I know, for over 20 years now. The bill aims to extend a Massachusetts standard driver's license to all qualified state residents by removing the current requirement of the lawful presence, which doesn't allow undocumented immigrants to apply for a standard driver's license. As we know, the state of Massachusetts right now has a two-tier license. So we have the Real ID, which this legislation is not looking to change anything to the Real ID. However, for the standard license, we are asking that it will be extended to undocumented immigrants, allowing them to apply for a driver's license. And as we speak, there are 16 other states, including Washington, D.C., who allows undocumented immigrants to be able, in Puerto Rico, to be able to apply for a driver's license. And this will require minimal changes to the Massachusetts law, and it will be in full compliance with the Real ID requirements. And we're just asking for undocumented immigrants to be able to apply for driver's license, because that means that everyone that is on the road will be tested and insured drivers to make our road safer for everyone. And it's also, you know, it's about dignity. And it's, we know that during this COVID-19, it was brought to light that our immigrants are essential workers. And we know that undocumented immigrants is among us. And we saw how they kept us going during COVID-19 pandemic. They were taking care of our families. They were the reason why food was coming to your table as farm workers. There were cleaning the MBTA station, the offices, the hospitals, to make sure that everyone can do their work safe. So they are essential workers. And as such, we're asking for an essential tool to just allow them to continue to do their work, and to continue to contribute financially to this, to the Massachusetts economy, because we know that they contribute financially to our state's economy. And with this COVID-19 pandemic, we also saw how, you know, undocumented immigrants were still crowding on MBTA buses. They were still riding with others because they don't have access to driver's license. And I don't know if others may have seen this, but in Nantucket, there was a specific case where there was an undocumented immigrant. There was a group actually taking rides, and from one person that had COVID-19, all of a sudden it spread, and it was about 15 people that became COVID-19 positive. So this bill is about, you know, justice, about dignity, is about allowing our undocumented immigrants to be a part of our society and no longer live in the shadows. And it's, you know, so that is the driver's license bill, I think, in a nutshell.
Yeah, and I think we can talk a little more about the details later as well. But so for the Safe Communities Act, this is actually this is a second session that we filed the Safe Communities Act. There's a 2-year legislative session in Massachusetts. We're nearly at the end of one. We filed it for the first time when Trump was assuming the presidency, but it has a couple of precursor bills. Something called the Trust Act was filed in both 2013 and again in 2015. And what this bill would do is end the involvement of state and local law enforcement in deportations. We've known for a long time that this kind of involvement makes it has a chilling effect on the ability of immigrants to seek the protection of courts. For example, survivors of domestic violence willing to file police reports, that sort of thing, or go to court as a witness. It also chills the reporting of crimes. And as you know, as you're aware, if you're an undocumented immigrant or you have undocumented immigrants in your family, it's a significant chilling effect to be willing to report crimes against you as a victim, or to report wage theft or housing code violations, whatever it is. And this has, of course, gotten worse under the Trump administration. But I'd like to point out that that basically the co-optation of state and local law enforcement to assist in the identification and deportation of immigrants is old. It's been around since, it's been used under Democratic as well as Republican administrations. And it, of course, became worse in the current, with the current administration. But it's not a new problem, and we want to make sure people realize that the incoming administration is not necessarily a ray of hope in this regard, and we need to be vigilant about it. The other reason the Safe Communities Act is important, though, is because one of the things that we've seen from all of you, from our connections in the medical provider community, is that it also has an impact on people's willingness to seek care in many cases, to seek medical care, to dial 911, in an emergency, because sometimes the police show up with the ambulance. It impacts the willingness of people to talk to contact tracers as well, as a response to the pandemic. So there's a lot of reasons why this is particularly important now, and we're anticipating probably by the end of the day, we're anticipating actually an op-ed from the Mass League of Community Health Centers and the Massachusetts Medical Society making that exact point. And that the Safe Communities Act is actually should be part of a public health response to the pandemic, to address these concerns and ensure that everyone knows that they can access care and cooperate with public health officials. Now over to Maria, you want to go next?
Yes. Cover All Kids is really a matter of health equity. We as Massachusetts always go out there saying how 98% of our children have health insurance, but that does not account for first of all, the ones that are uninsured, which is 2%, and those who have limited access to coverage, which means they may have a coverage program, but that is a program that doesn't meet their needs. And these specific bill, what it will do is will really ensure that children who are undocumented have access to the same services that other children in the same situation would have if it wasn't for the immigration status. This is really depenalizing children for being undocumented and ensuring that they have access to the healthcare services they need. Other states have done this, so I think that this is a time for Massachusetts to ensure that our children have access to mass health, and undocumented have access to children medical security plan, and it covers some stuff. However, it does have costs associated to the program, and it doesn't meet all their needs. It has a lot of limits in some of the services. So this bill, which we have filed, this was the first time we filed it as such, but we had tried to expand CMSP in the past. So we're looking into, let's see what happens at the end of the session, but we're looking into refiling this bill, and I'll give some details about that later on.
Amu, I think we can go to the next one. There we go. This is the part where everyone's eyes glaze over. Who wants to do this part? Should I just jump in here? We thought it was important for people. Not everyone's familiar with the state legislative process. I know I wasn't until I started doing this job 5 years ago. For a lot of people, the state legislature is not really even on their radar, but it's critically important to make up the gaps where federal legislation is not protecting people, for example. In the so the state legislature has a 2-year legislative cycle here in Massachusetts. We are nearly at the end of one, and what you're seeing here is sort of a normal 2-year session, right? And this 2-year session is anything but normal. It's very unusual. At the end of a 2-year session, generally by I think it's July 31st of the second year, formal sessions are over, and that's it. You're already planning for the next session, right? This year, we're sort of doing both at the same time. So we've got live bills. I forgot to mention that that all of these bills, well, the Safe Communities Act and the Driving and the Work and Family Mobility Act were both referred out favorably. I'll explain that a little further down the road. And they could be passed before the end of the session, and formal sessions are still active. It's up to the legislature to do something about it, but that's highly abnormal, right? That the session would be going on this long. So now everyone's trying to do both things, like advance these bills and plan for next session at the same time. So generally, what happens is, generally, the bills are drafted right now, right? September through January. We're working with lead sponsors, either seeking lead sponsors for new bills or working with the lead sponsors we have. And then the bills will be filed in January. there's a deadline the third Friday in January, which actually turns out to be January 15th. I know that's weird because it starts on a Friday. And then the sponsors are the ones who file the bills, working with the coalitions. And then there's also a drive to get other legislators to sign on as co-sponsors. And that's basically to show that they support the bill as well. It doesn't mean they'll vote for it, but it means it indicates support and it demonstrates that the bill has support. Also in January, actually probably February, the bills are assigned to committee that by subject matter, right? And so the Work and Family Mobility Act will be assigned to the Transportation Committee. The Safe Communities Act will be assigned to the Joint Committee on Public Safety and Homeland Security. And I'm not sure where the Cover All Kids goes first. Do you know, Maria? Is it the Public Health, Joint Committee on Public Health?
That is the first one. Yes, because it has two different committees. So the first one is the Public Health.
Right. So it goes to committee. And this is where advocacy really starts in earnest. Generally, a coalition there are usually coalitions of other organizations that work together to get these bills passed. So they often will have a legislative briefing at the State House, featuring experts like yourselves and others to come and talk about the importance of the legislation. Also, individual meetings with legislators are important. And then we also mobilize the public for constituent calls and that sort of thing. And then we also seek endorsements. And I think for this group, institutional endorsements are something that we can talk about, but they can be quite determinative depending on who they are, and also especially if they weigh in other ways with letters or meetings and that sort of thing. So the next thing that happens is generally in the first year, there's also a public hearing. This is required as a matter of state law. So this is a big public hearing before the committee that's handling the bill. And public testimony is invited, and they will say no to no one, so everyone can come and testify. Generally, the lead members of the coalition will help organize people into panels so that they can speak with their colleagues and have sort of a coherent presentation. Okay, next slide. And then in the second year of the session, there's a deadline. And there's a deadline. Remember I said that all the bills are before a committee? And this is sort of the deadline that it's a very critical deadline. It's when the committee has to decide what they're going to do with the bill. They can, for example, they can amend the bill in committee. There's a lot they can do, but what generally will happen, and this is called the Joint Rule 10 deadline. This year, I think it's February 3rd, right? It's the first Wednesday in February. The Joint Committee has a few things they can do. They can recommend that the bill ought to pass, which is actually exceedingly rare. If you imagine there are thousands of bills, thousands, maybe more than 1,000 for sure, filed every year, and most of them are not going to see action. Most of them are not going to advance. So it's very rare for a bill to get referred out of committee, which is why for the Work and Family Mobility Act back in February, and then the Safe Communities Act in July, because remember everything was extended, that was like the first time in either bill's history that they were referred out of committee. It was we had a lot of momentum coming into this session, both campaigns did. And then the pandemic kind of derailed a lot of this. The second thing they can do is they can recommend that the bill ought not to pass. That's rare too, because it's like publicly saying, we hate your bill. So what they generally do is they send it to study. That's the most common. They say, well, we're going to send this to study. We're going to think about this bill some more. Basically, they're killing the bill, right? That's what it means. But they just aren't saying so. The committee can act on either the House or the Senate bill. It can refer, what it does is it refers the bill, it makes a recommendation, refers it on to the next committee, right? In some cases, like with Cover All Kids, it's referred to another healthcare committee, healthcare finance, I believe, right? And then, but in the case of the other two bills we're talking about, both were referred to Ways and Means. And that's usually the final place, that's the final place a bill goes before it's brought to the floor for a vote in either chamber. Right? So next one. So if it does, so that's what I just said. If the bill survives like the Joint Rule 10 deadline, it goes to the next committee, or it goes to Ways and Means. If it's released from Ways and Means, it's brought to the floor of either chamber for debate and vote. If that's passed, it goes to the other chamber where they repeat the process, right? And then you usually end up with slightly different versions of the bill. Amendments can be made from the floor. They can be made by Ways and Means. And then a conference committee is appointed to negotiate the final bill. They release the final bill for passage by the House and the Senate, and it goes to the governor for signature. Now, the caveat here is that generally bills can sit in Ways and Means and just stay there. And what we've learned is, particularly with regard to the House, which is the more conservative body, bills don't generally make it to the floor of the House for a vote unless the speaker is convinced in advance that there are enough votes to pass the legislation. We saw an exception to this with the police reform bill, generally also over the objections of the governor. If we know the governor objects to the bill, as he has said in the past for both Safe Communities and the Work and Family Mobility Act, though he's been pretty quiet lately. But if they're worried about a governor's veto, then they want a supermajority so they can overrule it. So, and if they don't get it, it's very hard to advance the bill out of committee. In the case of police reform, when you had thousands of people in the street for several months, that can encourage that body to take a vote anyway, even though there's only a narrow chance of passage. Next slide. Oh yeah, do you want to talk about this, Maria? You like the budget process.
Sure. So this is, some people don't understand that we have the legislative process, which is a 2-year session, and then we have the budget process that is every year. The governor puts out a budget, then the House puts out a budget, then the Senate puts out a budget, then it goes to conference committee, and allegedly it should be ready to go for July 1st for the fiscal year. So the fiscal year at the state goes from July 1st through June 30th. Now, it's very common that we don't have a budget in place for July 1st. That has happened several times. This year has been especially different given the circumstances. There was a sense that we were going to be receiving some relief from the federal government, and because with COVID, there were so many needs. It has been, at 1/12 has been approved for several months. That means that they're extending kind of like the budget that they have. They're using the same template for budget for the 1 month at a time. So they've been approving this 1/12s throughout. And finally, they're now approving a budget for fiscal year 2021 that started in July 1st and goes through June 30th, which means I think they're going to apply this in January 1st. So it's just going to be for 6 months. So it's a very unusual year, but imagine that we are paying attention to the legislative session that's still ongoing, paying attention to the budget, which is just happening. And actually we expect the governor issued some vetoes, and now we expect the legislature to try to override some of the vetoes tomorrow, in fact. So we're going to have our budget by Christmas. And then the third thing that we're doing is preparing for the next legislative session. And guess what? The new budget session has already started, because in January, the governor is supposed to issue the budget for the next fiscal year. So things are just all together. We're like all trying to figure out what to do, because there are 4 things happening at the same time. How the budget happens is, this is what I said, usually the governor issues the budget in January, the House in April, the Senate in May, conference committees in June. Yeah, allegedly the governor signs it, by at some point to start in July. But as I said, it's very, very normal that they have to use the resource of the 1/12 and until they actually have a budget in place. This is very interesting because you can talk about what happens with the budget. And this year they're doing something similar. Usually there's a sense that line items that are outside sections that are not technically tied to the budget, the financial needs of the state, are not supposed to be attached to the budget. But it happens every year. Something kind of gets squished in. And Amy can talk about what happened in 2018, which was a great victory, even though it didn't move forward.
Yeah, it's sort of so I sort of look at the budget as like the Trojan horse for getting other legislation passed. They always say that we don't like to pass policy legislation in the budget, but Real ID was passed in the budget. by the governor, right? I mean, it was filed, as an amendment, as an outside section by the governor. So yeah, what happened in 2018, this is a little misleading. We didn't pass the Safe Communities Act, but we passed key provisions of the Safe Communities Act in the Senate budget. So what happened was, the bill gets sent to study and you're like, okay, what do we do now? Do we just, sit on our hands and wait till next session? And we decided not to do that. We went to the House and asked them to put it in their budget, and they wouldn't. And so then we went to the Senate and asked them, and we and our lead sponsor filed it as an amendment to the budget. And we worked the State House that night to like midnight talking to legislators. It was like being in a TV show. And then and they voted it at like, I don't know, 11 o'clock at night, something like that. So that is another way, but generally you can only do that if you have leadership on board. It would be really hard to do otherwise.
So this year, for example, they have attached an expanded abortion bill, they called it, to allow, women, yes, women, exactly, the Roe Act for women under 18 to make decisions, like I think it's 16 and 18, from 16 to 18, they could make the decision to have an abortion without parental consent. I think that's the way it is. It has been attached to the governor.
The governor vetoed the 16.
Yep.
Right. So that's what I was going to say. Even though that has been included, the governor has vetoed that section, and we're going to see tomorrow if this was veto proof. That's how they call it. Is this veto proof? So we'll see tomorrow if that has been attached or not. But as you hear, like, even though they say that this is just budget, this is just like programs that are needed to run the state, at the end of the day, there's always some kind of policy attached to this process.
Dalia, do you want to say more?
The only thing that I would add is that this legislative process can be a bit overwhelming. So I'll just add that sometimes you can also add provisions of your bill. You can attach it to another bill, or you could attach the whole bill, to another bill. We try to do that with the Working Mobility Family Bill. We try to attach it to the police bill because it is a public safety a bill as well, and we have the support of Major Police Chiefs Association, and we know that majority of a lot of the immigrants are Black and brown folks who end up being over policed. So we wanted to attach our bill to the police bill, and unfortunately, we didn't have the support of leadership on that. But that is another vehicle that you could use to pass a legislation if it doesn't go through the through the regular process that Amy went through earlier.
And I think what's funny too is how this works is the House version of the budget is different from the Senate, and they do it on purpose. And sometimes they agree in some things, but they kind of like trade off. I'm like, okay, I'll give you this if you give me that. And everything is negotiated behind closed doors. But so that you know that this is a negotiation in between the House and the Senate, and it's really a trade-off. And that's how they come up with the final budget. And they already know what's going to be vetoed, and they already know if they're going to be able to veto, to surpass that veto or not.
Okay, let's jump. Oops. Okay, I think we already talked a little bit about this, but yeah, so we were going to talk a little bit about each bill. Let's move on to the next slide. This I sort of talked about, right? And we can go to the next slide. You already know this. You are physicians, right? You know that people are afraid of immigration consequences when they're seeking health care. Obviously not deportation. They're also only deportation. They're afraid of the application of the public charge rule. And, so basically, which is also in some ways a fear of deportation, especially under this administration, right? But I had reviewed this stuff earlier about fears of talking with contact tracers. We've talked to a number of contact tracers who've talked about the difficulties in getting people to trust them. Next slide. So just really briefly, the Safe Communities Act does basically each provision of the Safe Communities Act addresses one of the ways in which state and local police and courts currently collaborate with ICE. And some of them are actually, like the first one is it prohibits law enforcement questions about immigration status. Actually, this provision is very common, is a policy that's been adopted by many police departments, because police departments know that if, you know, what they said to us when we spoke with police chiefs, it's like, why would we ask that question when we want people to cooperate with us? But we've also heard, for example, usually it seems to happen a lot in New Hampshire when people are pulled over and asked, you know, where they're from, that sort of thing. It happens with state troopers. We know it happens with people who are not police chiefs, you know, police officers. So this would create a statewide policy about not asking questions about immigration status, which have no relevance to criminal law whatsoever. The second thing it would do is sometimes if someone is, for example, driving without a license and they're arrested, right? As I said, for 10 years, we've had longstanding collaboration. One of the things we haven't been able to change with the federal government and can't change with this bill is that if anyone is arrested, that includes any of us here participating today, whether you are an immigrant or native born or whatever you are, everyone's information is reported to ICE. That's something called the Secure Communities Policy and Program, which has been around for a while, became operative in Massachusetts in 2009 under the Obama administration. And what it ensures is that ICE finds out about, you know, someone who's in custody, right? So like if I'm arrested, my fingerprints go to ICE, they check it against their database, right? So a number of things can happen. This means ICE is interested in you. One of the things that ICE does is they visit police departments and mainly houses of correction. Houses of corrections have jails, just like, and courts. So courts also have jails and lockups where people are awaiting, I don't know, an interview with a judge or hearing or adjudication, dismissal, whatever it is, release on bail. And ICE will come by and interview folks and see if they can identify people for deportation, right? And so the problem is immigration violations aren't crimes. And so you know how you all heard about the Miranda warning, you have the right to remain silent, you have a right to an attorney, etc. Everything you can say can be used against you. People don't get that warning when they're talking to an ICE agent. And they don't get it because it's not a criminal matter, right? And so the bill would require the equivalent of a Miranda order, of a Miranda warning to be given to each person before an ICE is allowed to interview them. And it would also be issued, you know, it would be a uniform form. They'd have to, the law enforcement would have to get the person to sign their consent, basically. And they'd be informed that this is an immigration interview, not to sign any documents, et cetera, et cetera. The next thing it would do is it would prevent police and court officials from notifying ICE when someone's about to be released from custody, say on bail. And the only exception is if someone has served a sentence of incarceration. And this is to prevent, you know, a court official from basically flagging to ICE that somebody's about to be released. And even though court, right now, ICE can't make arrests in courts because there's an injunction in place. That's not a permanent situation. We don't know how that case is going to be resolved. And also they can be outside waiting in the parking lot or across the street or at the person's house when they get home. So that would prevent that. And then the last thing is it would end these contracts that basically deputize state and local law enforcement to act as federal immigration agents. We have 4 contracts like this in Massachusetts. They're all houses of correction and the Department of Correction. So it's Bristol County, Plymouth County, and Barnstable County sheriffs all have these. And basically allows them, they don't need to call ICE, they can put people into deportation proceedings themselves. And we are the only state in New England to have these contracts, and we have 4, just saying. Okay, that's it for me.
Driving Families Forward Coalition, that's us. Next. So this on the screen is a map of the states that have passed the driver's license for undocumented immigrants. And as you can see, Massachusetts is not on that map. And we're hoping that Massachusetts will be the next state that passes it because it's been over 20 years. Next slide, please. I already mentioned some of these talking points earlier, that it will require minimal changes to the Massachusetts law, and we're not touching the real ID. And we just want to make sure that everyone who's on the road is tested, insured, and pass the vision test, so we can all be safer, right? And I also mentioned that driving is essential to the mobility here in Massachusetts, and we saw that even more during this COVID-19 pandemic, especially for our brothers and sisters in Western Mass. We may be able to have a little bit more mobility here when it comes to MBTA in the greater Boston area, but when it comes to places outside of Boston, it becomes a bit more challenging. And a lot more people need to rely on public, on other source of transportation. And we have seen cases where undocumented immigrants are spending $50 for an Uber ride to go to their work location, when they're barely making enough to pay for their utilities, right? Those are some of the testimonies we heard from our brothers and sisters in this fight. Next slide, please. So I mentioned earlier the outbreak which happened in Nantucket. There is an article that people can feel free to Google and read. And that's all due to the fact that undocumented immigrants are not allowed to seek a driver's license. And as I stated earlier, there is this misconception that if you're undocumented immigrant, all you have to do is show limited, ID to get the driver's license, and that is not true. Please don't consume that message. Aside from from showing proof of address, proof of identification, they have to do the same process as someone else who has lawful presence in the state would go through. We're just asking to extend it and to remove that lawful presence from the standard driver's license, to allow them to use the ITIN number, which is what they use to file their income tax, to use a bank statement, to use something that shows that they are a resident of Massachusetts, aside from showing proof of identity, proof of age, and everything else that we have to also show. And in terms of the health piece, we see that the spreading of COVID-19 and flu outbreaks and other illness in detention center, it's a risk for all of us, right? And the cost of mental health, due to the fear of children being separated from their family, stress, depression. We saw what happened at the border. There's still 628 children who need to be reunited with their families, and we usually think that doesn't happen here in Massachusetts. And a lot of people fail to realize that the reason a lot of those undocumented immigrants are in those detention and separated from their families is sometimes simply because of traffic violation, right? And that can happen for many reasons. Undocumented immigrants are on the road because they need to get to work. They're driving nervous because they're afraid, of police. They see a light, all of a sudden they're frantic, something happens, they get pulled over, they don't have a driver's license, and all of a sudden that's a crime, mainly because of their status, and then they're being shipped away from their children who are US born citizens. So just because it's happening miles and miles away from us, it doesn't mean that we don't contribute to the problem. If we really want to address the separation of families, then we need to make sure that this legislation is something that passes in Massachusetts to decrease, the likelihood of children being separated from their families. Next slide, please. And here I just have some image of these are people who tweeted during the pandemic of how buses were crowded, and these are buses in the communities that have been the hardest hit by COVID-19, Chelsea, Malden, Revere, and it so happens East Boston, that those are also the places with heavy undocumented communities, right? And they have to get to work. So they on these crowded buses when the governor was asking us to practice social distance, to stay home if we could, but they couldn't stay home because they are essential workers. They were the one going to clean your office spaces. They were the one going to the farms. They were the one at the grocery store. So they can't practice social distance in these environments, and they can't stay home because they're essential workers. So these are just some images for you to see that that those communities that are hardest hit is not because they out partying, is not because they don't understand the virus, is not because they don't want to contribute and help us, curb this virus, is because they can't, and that's the reality of it.
Well, we're going to move now to the Cover All Kids bill. I'm going to be straight to the point as possible. This is still possible because the legislature is still doing things, but it's very unlikely that this bill is going to move this session. I wanted to clarify what this bill does is really expanding access to mass health for kids who are undocumented. And at this point, they have access to Children's Medical Security Plan, which is an okay program, but it has a lot of limitations. So I'm just going to give you an example of which ones are the services that are not included in this, that are just included in CMSP, which is they have $200 maximum for prescription drugs. They have a top of 20 mental health visits a year, or they only have $500 available for durable medical equipment, and they can only seek, it only covers $1,000 in emergency care. You can realize that we have undocumented children who have a lot of medical needs, and these restrictions do not cover their needs. So this is what this bill is trying to do. There's around 30,000 kids that would benefit from this bill. Can you go to the next one? Well, I just wanted to highlight again that we always go out and about saying that Massachusetts has the highest insurance rate in the country for adults, and especially for children. That 98% of the children have health insurance. However, this does not take into account that many of our children actually have just limited access to insurance. Get to the next one. And these are kids who are low income. They would qualify for mass health if it wasn't for their immigration status. I think this is the time, as I said, to start penalizing children for being undocumented, especially when it comes down to healthcare and health coverage. And we would not be the first one to do this. Many people think that Massachusetts is always at the forefront of the battles for health equity and access and coverage. And the truth is that New York, California, Illinois, Washington, Oregon, and DC have already expanded comprehensive Medicaid coverage to all children. Next. Now, the biggest issue that we have is how much it will cost to provide mass health coverage to all these 30,000 children. So we know that this is going to be a very big problem, especially now that we're facing so many budget constraints. As we're facing the COVID-19 pandemic, there's going to be less and less taxes coming into the city, into the state. So knowing that this is quite expensive, we have a twofold strategies. For the next session, we're thinking about filing this bill as such, and then filing another alternative version in which we would extend comprehensive coverage to those children who have special healthcare needs. The caveat with that is that we know the financial tag comes especially for those children that have the needs, so we don't think this is going to reduce that much the price tag that comes with it, but it is the right thing to do, and we're going to be pushing these two avenues next session if we can move this forward. Next, and passing over to Amy.
I think we probably all have something to share here. And I guess I'll just speak from the perspective of, I'm wondering if we should, I want to make sure we have time for questions too, but I'll just do a little pitch here, which is to say, one of the reasons that we're here today is because we want to emphasize how critically important your advocacy is for our work. And I can't emphasize enough how valuable your engagement. I know, and I'd be looking, except I can't see her right now. I'd be looking at Dr. Danaher. There she is. How critically important it has been to have neutral professionals advocating for a bill, because even though, you know, all of us are trusted, you know, we're trusted advocates. In fact, legislators look to us, you know, for help getting their bills passed. They look to us for advice about the impact, for example, of various policies on immigrant communities, on other communities that we work with. But we're still seen as advocates, right? And we're, you know, they know that we're trying to get this legislation passed, and that's why for physicians to engage and advocate on these issues, it has an incredibly, it has an arresting perspective, I would say. I mean, it makes legislators stop and think. And I just want to highlight, for example, on the Safe Communities Act, I know that Dr. Danaher worked with, brought a team of medical directors and infectious disease specialists and a few others to meet with the chairs of the Public Safety Committee. And I don't think that they had ever considered the public health impact of this legislation before that happened. We also were able to secure the endorsements. Endorsements are a huge way of getting involved, getting your institution to endorse, even if it's not maybe your full institution. Like, we didn't get MGH's endorsement, but we did get MGH Chelsea Healthcare Center and MGH Revere Healthcare Center. We got the Massachusetts Medical Society. We got the Massachusetts League of Community Health Centers. And I know that there are other like sub-entities within your institutions that could be, that might be willing to make an endorsement, and not only endorse, but also write a letter to leadership, maybe join a meeting, work with advocates, and actually sit down with legislators. Another way you can be involved is joining us as panelists. We've done that as well. We've had healthcare professionals be panelists at legislative briefings to talk specifically about the public health impact. We did that early in the Safe Communities Act campaign last year. The other way, and I know Maria has done a lot of this, her organization has done a ton of this, working with providers to get stories of like the impact, the impact of not passing this legislation, like the current situation, how it impacts your patients, particularly your young patients. And then obviously, like the biggest sort of easiest one-off is showing up for a public hearing. You know, we reach out to us, we'll reach out to you. It's different, again, when you have a panel of like 4 or 5 doctors sharing the stories of their immigrant patients. Legislators hear that differently, right? It's not fair, you know, and they also, of course, want to hear from directly impacted people. So, but we can't, I know, you know, you're not going to bring your patients in, but we've obviously had, for example, you know, we've had panels of, you know, survivors who are willing to come forward, survivors of domestic violence and sexual assault, talk about how important a change in the law would be. So, yeah, I can't emphasize enough. And I know, Dalida, I want to turn it over to you, because I know that the public health impact of the driver's license bill would be quite important. And I want you to, you know, feel free to jump in here and add to what I just said.
Yeah, sure. You know, as Amy pointed out, they look forward to hearing from experts, right? And we're advocates, so they know we want to get this done, and they need other voices, which is why it's so important. You know, for the driver's license bill, it was so important to get the police endorsement. It was so important to get healthcare advocates to come and testify on behalf of the bill. We know that when children are operating out of fear, their health is impacted. Their ability to function in school is impacted. So it was so crucial for legislators to hear from folks in healthcare of how that impacts their overall health, because sometimes they just so tunnel vision and they can't see outside of just the fact that this is to allow undocumented immigrants to obtain a driver's license, that we have families who are, most of our families are have mixed status. So you have a US born children who is in constant fear, and a parent who may not be able to drive that children to the hospital to seek medical care. But then not only that, for the physical, but for the mental and emotional piece of it, then that child is no longer functioning at the capacity that that kid can in school. So it's the holistic health, right? And it's really, really important to hear the voices of healthcare providers when it comes to advocating for these legislations.
And I'm going to add, for Cover All Kids, it's especially important because we made a mindful decision not to expose the families that may be impacted, because these are undocumented children, and we felt it wasn't fair to have them at the forefront, which sometimes can be very powerful, but we felt very uncomfortable exposing them. So we heavily relied on providers to share the stories that they've seen from patients, which you don't have to share the name or like specific information, but just like the story of like what are the struggles that your patients are facing. And also for testimony, for public hearings, we really, when we did the hearing for Cover All Kids, we had different panels, and we really needed healthcare professionals, and many stepped up to the table and really provided a very, very powerful testimonies on this. But if it wasn't because of the voice of the healthcare professionals, we may not be able to highlight this issue of kids that need extra access to services.
Okay, I think we should open up for questions. We've had folks sitting very quietly here. Oh, and these are some links, which, you know what we can do? We can send these. Actually, I think I know that these are ways that you can like immediately send a letter to not just state legislators, but also the governor. And I know we both have these active campaigns that make it super easy. You just add your paragraph to the template that's there. You can change it, you can do whatever you want, but there's a template, and it's one click and the letter goes to legislators. I think, yeah, I could put the links in the chat. The only thing that I'm concerned about right now is we're in the process of updating ours because we want to include the link to the op-ed as soon as it drops today. But I will give them to you. And I'm also thinking, I don't know if you were planning any kind of follow-up, Fiona, or, oops.
We're always happy to follow up.
Right? So, you know, we could send the links out. We can send, if you want, I could send it to you and you could send it out. How would that be? Yeah.
Excellent.
Okay. Sounds good. But yeah, that link will work, but right now I'm not sure what it will send. That's the problem. Okay. Yeah, I think it might work. You could try it.
So thank you all so much for explaining this very complicated process. Every time I hear about it, I wonder how anything ever gets passed. And so the fact that you've pushed these bills so far is absolutely amazing. I'm curious, besides signing on to those letters, in the next few weeks before the legislative session officially ends, gosh, I guess it's only 2 weeks, what actions can we take to be helpful?
Well, you know, one of the things you could do is, let me think about this. I'm going to let someone else speak while I think about this, but I thought right away that one of the things you could do is write letters to the editor of your own local publications, right?
Yeah.
Right. That's one thing you could do.
Definitely. And I think, as Amy pointed out, the governor, you know, had a threat to veto both bills, which makes it a lot harder for us because we know we need to get veto-proof majority, which is, we've seen in the case of the police bill, didn't get veto-proof majority. So he was able to make amendments as he pleases and send it back. So we need to make sure we have veto-proof majority. And so he needs to hear from you that this is something that you would like to see get done in the state of Massachusetts. And we also know that there are, if you live in what is known as a purple district, a lot of the legislators in purple districts, in the case of driver's license, South Coast is a big is a problem. New Bedford, Taunton, that that area is a real problem. So those, if you live under those districts, it's really important for legislators to hear from you, because they're constantly telling us, we don't hear about this legislation enough in my district because it's a purple district and people don't care about it in those purple districts, or they're afraid of losing their seat in those purple districts. So if you know you live in a purple district, or you live in the South Coast area, make sure you send letters, emails, publish something, an op-ed, and that will help us tremendously. And send emails to leadership, Speaker DeLeo, Governor Baker, Senate President Spilka. Those are people that needs to hear from folks constantly, regardless if they're in their district or not, because they are the they're like the top 3 most powerful people in this state.
Could you say their names again? Governor Baker and the other 2?
Speaker DeLeo, Speaker of the House DeLeo, and Senate President Spilka, Karen Spilka, who is also a social worker. So she comes, yeah.
I'm also going to drop, so our Facebook page is going to be, sharing social media posts would be great too. I know we're going to be doing some stuff on Twitter later, but there's a Safe Communities, Facebook page, and then the Mirror Coalition also has, let me just see how I'm going to drop it in here. Yeah, and you can look for, we're going to be posting a lot this week. So that's just on Safe Communities. As far as, that's just like one more thing you can do, right? Just get it up here.
And in terms of coverall kits, I think we're more preparing for the next session. So we need stories. So if you guys want to reach out to me and like share stories, if you have them, we really need that in order to like push for the bill next session. If we don't hear, if legislators don't hear about the impact on the children, they're not going to pass the bill. They want to hear that. They want to see that, what the real impact is.
Yeah, the other thing I'm thinking too is that, there might be, I don't know how cohesive this group is, but I know that, now you have tell me the exact name of the center, Fiona. The
MGH Center for Immigrant Health.
MGH Center for Immigrant Health. I mean, the other thing is, we are in communication with each other, and we can certainly share information with folks as, at key steps in these campaigns. And we can also, if there is a group here that wants to throw down, for example, we are already planning for next session as well. If there's a group here that would be interested, I know that both of our campaigns would love to have more participation by physicians. I also know there's some institutions we haven't gotten on board yet, like Cambridge Health Alliance, Boston Medical Center. I know that medical institutions can be really, are like really careful about endorsements and that sort of thing, because they have legal teams that warn them, and they worry about federal funding and everything else. But that doesn't mean people shouldn't try, and that doesn't mean we couldn't benefit from stories from those physicians as well, and that would be true for any of our campaigns, and we would love, to stay in touch with this group. It's been an incredible collaboration so far in its uninstitutionalized form. We'd love to have it continue.
We would too. Thank you so much.